It wasn't a systematic way of how do we get a pharmacist to support people to die at home. And I felt that surely someone around the world was doing this in a way that we could learn from and adopt for Australia. Hi, my name's Helen Stone. I'm the State and Territory Manager for the Pharmaceutical Society. I look after South Australia and Northern Territory. I have a very diverse role. I primarily look after members, and our members are pharmacists. But we also have a strong responsibility to work with governments, and so I work with the South Australian Government and the Northern Territory Government. PSA also has a role with advocacy and pharmacy practice improvement. So we're always looking for ways where pharmacists can provide and support better medicine safety, quality use of medicines. So I might be involved in improving access to vaccines through community pharmacy in South Australia and Northern Territory. Or it might be medicines shortages. I represent PSA on a TGA medicines shortages action group, or working with bodies like Palliative Care Australia, Palliative Care South Australia, the Voluntary Assisted Dying Review Board in South Australia that I'm also a member of. So it's a very varied role. And it's up to state and territory managers to really find those opportunities to influence the influencers, and to work with our members to achieve better pharmacy care in Australia. Every day when I turn up, it's a different day, it's a different topic. Some days I think, oh yeah, I'm going to do this, and I end up with a completely different problem to be solved, or a pharmacist that needs our support, or a response to government. So it's the variety, the mental challenges every day, but also the flexibility, and the fact that I get to work with amazing people doing all sorts of amazing things every single day. So I think that continual challenge of what I do is the reason why I'm still here, and I still find the passion for pharmacy. I've had some key influences when I've been deciding what I was going to do, and which direction my career took. I think very early on, as a very young science student at the University of Adelaide, I started working for Lloyd Sansom, and that changed the trajectory, and I went from pharmacology and biochemistry into pharmacy, and we worked on some drug trials that were very interesting. It was very primitive back then, and a lot of fun, so that really set the trajectory into pharmacy. I worked at the university where I worked with a lot of really interesting people, but also some really passionate pharmacists when I was working as a locum. So yeah, that kind of took me well into the community pharmacy space, and I loved the people. Then there was an opportunity to work for the Pharmaceutical Society, and then people like Paul Tate turned up on my doorstep, and explained a problem that he had around access to palliative care medicines. Working for the PSA, and it meant that I could really explore what that meant, and assist in solving that problem, or trying to solve that problem for that Paul had. And I went, oh, that's really interesting. I'll just keep doing some of that. I've been very fortunate to have had a lot of projects here in South Australia, particularly with a focus on palliative care. There have been some other projects, but the palliative care ones I've found most rewarding. They came out of some initial work that we did based on Dr. Paul Tate's research around access to a core medicines list in community pharmacy. And then expanded into, well, how are pharmacists involved in palliative care? We were given an opportunity to have pharmacists embedded in general practice in regional South Australia and rural South Australia, and that evolved into pharmacists involved in aged care. And then it just was this constant evolution. Pharmacists in aged care should have palliative care competency as well. And what did it look like to have a pharmacist embedded in an Aboriginal health service with a focus on palliative care? So it was a natural progression of projects. And then I was very fortunate to get some funding from the South Australian government to really explore that in regional South Australia with a palliative care pharmacist in aged care and a palliative care pharmacist in community that really had no handbrakes on how they practiced. So it was a privilege to be able to kind of really look at that and go, well, if there are no restrictions on what and how these pharmacists practice other than their scope of practice, how does that serve their community and support the general practitioners that she was working with? So that kind of evolved into, what else was people doing around the world, and I did a very quick and basic literature review, looked at the grey literature, who was doing what around the world, and couldn't really find a lot of evidence for best practice. So then I stumbled upon the opportunity to apply for a Churchill Fellowship, which gave me an international travel scholarship to go and talk with people and listen to them firsthand. So it's that kind of immersive kind of learning while concurrently running a project in South Australia for a palliative care pharmacist. And then post-Churchill Fellowship has evolved even further now with pharmacists in dementia care, dementia support pharmacists, again with that palliative care lens. I applied for a Churchill Fellowship in the beginning of 2020, the start of the pandemic, not the most sensible thing in a global pandemic. That process is an intensive, reflective application process where you really need to think about what you want to learn and where you need to go. So I wanted to look at comparable health systems, and for me that was Canada, the UK and New Zealand, and spoke with academics but also pharmacists, community pharmacists and palliative care pharmacists across those countries. What I saw in Alberta in Canada was pharmacists having access to joined up medical records in real time. They could see hospital, they could see community pharmacy dispensing, they could see 24-hour blood glucose monitoring. And so that kind of went to me, well, this is what we need, is better joined up care where there's a shared patient record that enables all health professionals to work from the same set of information. So that was really interesting to see that in practice, and it wasn't necessarily in context of palliative care. In fact, one gentleman I spoke to, his area of practice was in diabetes care, and he had a strong following of patients. And that to me kind of went, well, you could take his model of care and insert any chronic condition and go, his scope of practice is this, but you could translate that into palliative care. So that was the sort of one thing that I took away. Pharmacists in all of the other countries that I visited could prescribe, and it wasn't directly comparable, but it was very different to what we had in Australia. And I was very sceptical before I travelled about pharmacists prescribing. Complete 180. For palliative care, for pharmacists with competency in chronic conditions or specialty in particular areas, they're not diagnosing. This is around medicines management and responsive care. So for palliative care, we know that health conditions change. You might need to change medicines really quickly to respond to symptoms. And that's where I saw pharmacists prescribing in other countries, where they could be really responsive, and part of shared care between a clinician and the pharmacist to support patients. So really changed my perspective on that, and I think pharmacists in Australia should be independent prescribers, which is not something I would have said before I travelled overseas. And then I looked at, particularly in Scotland, that has the same kind of remoteness access. I know Scotland's very small, but the roads and the access to patients, particularly in the Highlands, are very comparable to Australia, and how they were enabling pharmacists to outreach from hospice. The shared challenges were workforce, funding, sustainability, but I think they were two key takeaways that I brought home with me. Pharmacists are increasingly aware that there are opportunities beyond community pharmacy and hospital pharmacy, but actually that really complement those traditional areas of service delivery. Pharmacists are interested in working in general practice. They want to work in aged care. Pharmacists are really embracing in South Australia the opportunity to deliver full vaccination services in their pharmacies. So I think it's this, we're finding our place, our niche. We don't have to do all things for all people. We've seen a lot of pharmacists now embracing the opportunity to do prescribing training. Not yet enabled in South Australia, but it's imminent and it's coming. And people are excited by the possibilities that we can do these other things, and we can branch out from our traditional roles, and we can really be that connector across settings. And being a patient advocate as well. So I think that opportunity to pharmacists for really embrace their profession, and find the place that is their purpose, their interest and passion. My passion for pharmacy, I think, started probably when I was about 18 or 19, working for Emeritus Professor Lloyd Sansom, and it was that connection between people. I find people and all of our differences fascinating and interesting, but also that intersection between the people side of pharmacy but the chemistry side of pharmacy. I think that that was sort of a strong foundation, but then as I have progressed through my career, the realisation that not everybody likes to do things like sit in front of a camera, talk with politicians, agitate for change. And I don't mind doing those things. I don't mind putting myself out there if it's for the right reasons. And then I guess the other part of it is that I'm continually inspired by people who, when you provide them with an opportunity or you help them start a different way forward, they take that and then they make it into something better. And I think that I get a lot of professional satisfaction out of seeing the success of others where I've had a small part to play in providing them with an opportunity. And that to me feeds my passion. But also provides that professional reward. Outside of the workplace, I am a hockey player. My family plays hockey. My community have just built a wonderful new hockey pitch at Unley High School in Adelaide, South Australia, and to be able to bring that community together for my hockey club, which is the oldest hockey club in the Southern Hemisphere, gives me immense joy. And when I'm not playing hockey, I can be usually found doing things like learning to quilt with my daughter and learning sashiko stitching, and those sort of creative gardening, whatever, but also hiking. So yeah, it's kind of active out of the office things that help reset my brain.